on the level.
What are the reasons that passing healthcare laws have been so difficult and controversial in the U.S.? This year, Paul Ryan and Congress Republicans attempted to repeal Obamacare by passing the American Health Care Act, or the AHCA. Huge bills like the AHCA frequently take a long time to go through Congress, and the political process of passing the bill can get ugly. In their article, Thomas Kaplan and Robert Pear write,
"The Nonpartisan Congressional Budget Office said the first version of the bill would trim the federal deficit considerably, but would also leave 24 million more Americans without health insurance after a decade."
The original version of the AHCA was not well received by Congress at all. It went completely dead in about 2 days in Washington. House Republicans, knowing they didn't have enough votes to pass the bill, delayed the vote and worked on redoing it the very next day. After making some changes to the bill, it was clear that it still would not have enough votes to make it through the House of Representatives. Speaker of the House Paul Ryan visited President Trump the next day and told him to cancel the vote, but Trump said they would continue with the vote anyway. However, Ryan called Trump a few hours later, again trying to convince him to cancel the vote. The president gave in and canceled the vote after realizing it was clear the bill was not going to pass. The bill spent a month in a rewriting process before going through the House again. This time it passed, but it was clear it would not go through the Senate. Currently, it is being rewritten again in the Senate committee. This process will have to finish before Congress Republicans will try to pass it through both houses. Political stalemates that occur from passing healthcare bills are very common in U.S. government. When a healthcare bill reaches Congress, it is expected that it will be bitterly debated and go through many different versions and votes before it gets passed. Healthcare bills have a way of dividing Republicans and Democrats intensely. Party lines are easily visible when a healthcare bill goes through Congress. Throughout the 20th century, several monumental bills have been passed that have helped healthcare laws become more accepted and common. The first attempt by a president to establish a major healthcare law along with universal healthcare came from Harry Truman early into his presidency during November of 1945. To summarize them, the first provision was the addition of medical professionals in low-income areas. Truman planned to accomplish this by attracting them with federal funds. The second provision was to establish new hospitals in low-income areas. He planned to pay for this with federal funds as well. The third provision was the creation of new health regulations and requirements that the new hospitals would follow, as well as forming a board of doctors to determine certain federal funds to medical research. The fourth provision was the most controversial. It proposed a universal healthcare system that was to be funded solely by the government. It would have been open to all American citizens but not required. The bill arrived in Congress as a Social Security expansion bill. It was nicknamed the WMD bill because of the acronym created by the last names of the Democratic senators who supported it. The bill received an intense backlash from the American Medical Association, AMA, who at the time was a very powerful company that represented the current privatized healthcare system in place at the time. The AMA swayed opinions of the bill in Congress by launching a vicious campaign against it. The Truman Library states,
The American Medical Association launched a spirited attack against the bill, capitalizing on fears of communism in the public mind. The AMA characterized the bill as socialized medicine, and in a forerunner to the rhetoric of the McCarthy era, called Truman White House staffers followers of the Moscow party line.
Truman was forced to drop the bill after the Korean War started. Truman's efforts did not go unnoticed, and the debate over health care was brought up again in Lyndon B. Johnson's presidency, except this time, new healthcare laws succeeded in passing. At the time of LBJ's inauguration, more and more American citizens were joining the privatized health system that the U.S. government was funding in an indirect way by giving tax cuts to private healthcare companies. Another factor was the American Medical Association's large involvement in shutting down healthcare bills in Congress. The beginning of the healthcare debate came during John F. Kennedy's presidency, when Democrats attempted to raise awareness that citizens over 65 had a hard time paying for their health care because they had twice the cost as anyone under 65. This led to Medicare being proposed, which Kennedy supported. He thought it would pass because Social Security was so important to American citizens at the time, and this was a similar measure. However, Kennedy, similar to Truman, ran into the wall of the American Medical Association. The AMA once again started a ferocious campaign against the health legislation. Opposition was also found in conservative Democratic Chairman Senator Wilbur Mills from Arkansas, who didn't support the proposed form of Medicare. Julian E. Selazar writes in How Medicare Was Made.
What most troubled Mills about the Medicare proposal was that its costs would grow rapidly, especially when voters learned that physicians' bills were not covered by the program and pressured legislators to add those benefits as well. With Medicare, Congress could be forced to raise Social Security taxes beyond reasonable levels, resulting in a backlash against the entire program.
The AMA had great reliance on Wilbur Mills' views on the bill. When LBJ became president after Kennedy's death, he made it clear that passing the healthcare bill was first priority. But even with his emphasis on House Democrats working on a compromise with Mills, Mills still did not hold a vote. After LBJ won against Barry Goldwater and Democrats won a huge majority in Congress, the tables turned and Mills' vote would not be needed to pass Medicare. Mills, along with Congress Republicans, realized that the passage of Medicare was unavoidable, so they joined in on proposing alternative plans and suggesting lower costs wherever possible. Mills still had a large effect on the passage of the bill. It was him who proposed the three-layer cake, which was the final form of the bill. It ensured that all of Mills' worries about costs would be covered by the bill. This new legislation was later called Medicaid. The Medicaid proposal was brilliant because it turned the bill into a guaranteed pass, something Republicans could not refuse. The American Medical Association was not a threat anymore, and Mills refused any other liberal amendments to the bill, save one, which he determined would not raise any significant costs. The legislative process that LBJ and Congress went through to pass Medicare and Medicaid can be compared to the passage of the Patient Protection and Affordable Care Act that Obama passed in 2010. In some of the earliest stages of his campaign, Obama promised large reform of the healthcare system. Within 6 months of his inauguration into the presidency, he created a major healthcare bill and sent it to Congress. During his time in Congress, the bill went through many different versions and its progress was extremely slow. Disagreements and debates in Congress over the bill could be described as large thickets, brambles, and thorns that the legislation had to get through. The bill was finally passed as a result of some very creative processes Democrats went through that involved political maneuvering strategies that eventually paid off. eHealth Insurance Resource Center states,
Now lacking the 60th vote needed to pass the bill, Senate Democrats decide to use budget reconciliation in order to get to one bill approved by the House and the Senate. The use of budget reconciliation only requires 51 senators to vote in favor of the bill in order for it to go to the president's desk for signature.
The Patient Protection and Affordable Care Act got necessary approval in the House on March 21, 2010. The legislation was signed into law on March 23, 2010. After synthesizing Trumpcare with 3 other significant healthcare events in history, the question still ponders, what are the reasons that passing healthcare laws have been so difficult and controversial in the U.S.? First, the idea of government-provided healthcare itself is something that liberals and conservatives disagree on. On the liberal side, universal healthcare represents big government supporting the people. Big government is not something that conservatives hold dearly, and they also do not like the idea of citizens relying on government. Second, healthcare is extremely complicated. As much as one side wants it, it still takes a long time to organize a bill that satisfies both sides enough to pass.
Given that he recently said this,
we have come up with a solution that's really, I think, very good. Now, I have to tell you, it's an unbelievably complex subject. Nobody knew that healthcare could be so complicated.
everybody knew that. Everybody knew healthcare is complicated. Literally everybody. It is the one thing people know about healthcare. It's complicated. It's like you're saying, who knew King Tut was dead? Everybody did.
Third, universal healthcare takes up a lot of the federal budget, and if less people have it than the service needs there to be, it can increase the national debt quickly. Fourth, full-on universal healthcare where everyone is covered and an abundance of low-risk pools are created may work perfectly and balance the federal budget, but it is not in conservatives' best interests. This can be seen in the effort to repeal Obamacare.
Underneath the palm trees, you can leave your worries. I don't need nobody, you and me together.